Dr. Fong, we hear a lot about cleaning, brushing, flossing, and the teeth and the importance of it, and about mouthwashes. Tell us a little bit about, even though we hear so much about it, but now we have electric brushes that are really better than the other ones, soft brushes, hard brushes, and any type of flossing. Anything you can tell us about flossing, which, common mistakes you see as patients doing constantly, and basically make us aware of this process, please.
Well, as consumers, we have a myriad of options available out there. As you had mentioned, as far as toothbrushes, there's the regular manual toothbrushes that we have, electric toothbrushes. Electric toothbrushes are fantastic because they use the technology that enables us to be able to more efficiently clean our teeth, because many times we may just go in there and brush and we think we're brushing for 2 minutes with the manual toothbrush, but in actuality, if you time it, it's probably really about less than 30 seconds. Using electric toothbrush that has the technology to have a timer on it, that enables you to stay true to brushing your teeth for essentially 2 minutes. By brushing for 2 minutes, you'll be a lot more thorough in cleansing of all of your teeth there. Also, the way that the electric toothbrush has been designed, it can help you to brush areas that are more difficult to reach or access, and then it can clean in between the teeth there much more efficiently than just using a manual toothbrush. As far as dental floss, we're all familiar with the regular dental floss of either waxed or unwaxed. Many times that's based on a personal preference of what you're able to use and comfortably use to floss in between the teeth there. But today we also have water irrigators that you can use to help to clean in between the teeth there, which helps to massage the gum. So that leads to a more healthier gum tissue by having that water cleanse and remove the debris, and at the same time help to massage to keep the gum tissues stronger and healthier. Yes.
Go ahead.
Yes, Helmut?
Go ahead.
Let's see. I'm trying to remember what other thing that we had.
I think you were going to the flossing part now a little bit.
Yes, I already spoke about the flossing, and then there was something else that you were asking about.
Well,
I can't remember.
You explained that.
Mouthwashes, right?
Say that again.
Mouthwashes?
Mouthwash, maybe?
Yeah, I think that was the next third part of the question. Okay.
Yes.
So as far as mouthwashes available out there are mouthwashes that contain alcohol and those that do not. I think essentially one has to remember is that the alcohol mouthwashes could be uncomfortable, so it's probably better to use a non-alcohol based mouthwash. As far as over-the-counter types of mouthwashes that are beneficial for you, Listerine would be the best. I'm not promoting it, but it is one of the proven types of mouthwashes that can help correct gum disease. The remaining types of mouthwashes are simply just that. They're breath fresheners. They don't have any therapeutic effect, but they at least give you a nice, cleaner, fresher breath.
Is there anything about the toothpaste you might want to let us know?
Well, as far as toothpaste, I think the most important thing is use toothpaste that has fluoride. There are toothpaste out there that has a desensitizing agent for those people who have sensitive teeth to hot, cold, sweets. So using a desensitizing toothpaste will help to reduce some of those effects on your teeth there. But the most important thing is to use a fluoride. I know some people don't want to use the fluoride because of their beliefs that it could be toxic. And so there are natural toothpastes out there. But the whole purpose of using a toothpaste is to mechanically help to remove the plaque that's adhering to the teeth. And plaque is colorless. You can't see it. But unless you have that toothpaste, it will help to brush away that debris that is adhering to the teeth there.
Got it. So let me ask you something. About 15 years ago or so, I was living for a couple of years in India, and everybody used a tongue scraper. So I used one too, but in the meantime, I don't use it anymore. But I still do brush my tongue with the toothbrush, and even though in most cases, I gag a little bit, but you get used over the years to so what's the story there? Is brushing the tongue a good thing in the first place? If it is a tongue scraper better than the brush? Tell me, please.
Well, the tongue has these little projections on there that kind of resembles like a wheat field. And so germs or bacteria can be lodged in between there. And so using a toothbrush to brush your tongue to try to remove that bacteria, or using a tongue scraper, would be just as effective as removing the bacteria there. Whichever choice you make, as long as you're brushing the tongue to help clean it, that will help to reduce the bacteria that's living in those tongue structure projections.
Okay. So cleaning the tongue is actually a needed or a good thing.
Yes, it is needed. It is a good thing. So brushing the entire mouth, all of your gums, all of your teeth, your tongue, the roof of your mouth, the cheeks, that will help to remove all of the bacteria that's living in the mouth, in the oral environment.
Good. Thank you very much, Dr. Fong.
You're welcome.